Welcome to the Caladrius Health Channel. In our ongoing series on India's digital health infrastructure, we've already explored ABHA and exactly how patients participate in the ABDM ecosystem. So today, we're looking at the provider side of that equation, the Health Facility Registry, or HFR, and the Healthcare Professionals Registry, or HPR.
To really wrap our heads around this provider ecosystem, we're going to trace the journey from foundational concepts right through to the practical registration steps. We'll start with the trust layer, define these two registries, and explore their operational workflows. Then, we'll walk through the registration process, talk about data readiness, and finish up with some emerging developments. Let's jump right in.
Okay, Section 1, the ecosystem's trust layer. To understand why HFR and HPR even matter, we first have to look at what ABDM is structurally trying to accomplish. You see, the ABDM framework utilizes a federated health data architecture. Essentially, this means patient data stays right at the source, securely within a facility's hospital or laboratory management systems, and it only travels with explicit patient consent. Because there isn't some massive central database holding everyone's records, every single entity interacting in the network absolutely has to be independently verified.
Think about it like this. When data moves, say an NHCX claim is routed from a healthcare provider over to an insurer, there are basically two silent questions that must be answered before a single byte of information travels across the network. First, is this facility authorized to participate? And second, is the professional who generated this clinical record actually credentialed to practice? Answering these silent verifications is the core function of the trust layer.
Moving right along to Section 2, defining HFR and HPR. Let's take a closer look at the two specific national repositories maintained by the NHA that actually make this secure verification possible. These two digital identities essentially mirror each other to establish trust. First up, we have the Health Facility Registry, or HFR. This is the national repository for hospitals, clinics, labs, and pharmacies. Now, if a facility is already in the pre-existing National Health Resource Repository, that registration data actually pre-fills, which really streamlines the process of providing the facility with its digital identity, an HFR ID. On the flip side, for the individuals actually providing care, we have the Healthcare Professionals Registry, or HPR. This is for practitioners like doctors and nurses. And crucially, this isn't just some self-certified form. It's strictly verified by state medical and nursing councils, which then grants the practitioner their unique HPI ID.
Just to give you a sense of the sheer scale here, as of late 2024, there were nearly 3.5 lakh facilities and over 5.2 lakh professionals registered across the country. These NHA-maintained registries provide the trusted infrastructure needed to support over 68 core ABHA patient identities. Now, while the patient registry naturally gets the bulk of public attention, these provider registries are literally what give that digital attention a solid, secure infrastructure to stand on.
And that brings us to Section 3. Operational workflows and relevance. It's actually really helpful to view these registries not just as a one-time onboarding formality, but as essential gateway conditions for live operational participation within the whole ecosystem.
A verified HFR ID is deeply embedded in everyday essential workflows. For example, you simply cannot submit an NHCX claim without an active facility and professional ID. And looking at financial incentives, the Digital Health Incentive Scheme, or DHIS, offers up to 4 crore rupees, but exclusively to facilities registered on HFR. On top of that, PMJOA's Hospital Engagement Module strictly requires an HFR ID for empanelment, and the National Medical Commission has made HFR verification a mandatory compliance record for medical college accreditation, so it's pretty vital.
Let's shift gears into Section 4, the registration process. Having established the why, let's look at how healthcare administrators actually navigate the practical registration steps.
For the standard web portal flow, Step 1 is obtaining an HPID. This is a crucial operational dependency, meaning the administrator completing the facility registration must first hold their own valid HPID. Once that's secured, Step 2 involves logging in, completing the HFR form, and mapping the facility's location right on the platform. Then Step 3 is simply awaiting verification from a state or district administrator. It's a pretty straightforward process, generally taking about 20 to 30 minutes when all the facility classification documents are prepped in advance.
Now, for IT teams integrating their hospital systems directly with ABDM via APIs, the programmatic sequence is effectively identical. Step 1 is authenticating the session token. Step 2 requires creating the HPID via Aadhaar and council credentials. And finally, Step 3 is registering the facility via the HFR APIs.
The exact same sequencing dependency applies here too. An API call to register a facility simply won't process without first securing a valid HPID token. Next up is Section 5, Data Quality and Operational Readiness. Because of how integrated these systems are, it's super important to treat registry enrollment as a live operational record, rather than just a one-and-done checkbox.
The really crucial point here is how data field accuracy directly supports smooth operations. Take the facility category field, for instance. Accurately selecting this during registration ensures correct scheme eligibility down the line. For infrastructure status, any changes or expansions in the services a facility offers post-registration should definitely be updated to keep the registry current. And regarding council credentials on the HPR side, ensuring full and accurate council details prevents verification delays. That keeps professionals equipped with their active HPIDs without any frustrating interruptions. Finally, let's look at Section 6, Emerging Ecosystem Developments. We're going to look ahead at 3 upcoming developments that demonstrate exactly why robust registry onboarding is increasingly vital across the entire healthcare landscape.
First, the NHA is expanding the HPR to include paramedics, ABHA workers, and allied health professionals. Structuring a scalable onboarding process right now makes adapting to this expanded scope much easier down the line. Second, facilities moving their software to the ABDM production environment now require a safe-to-host certificate from a certain impaneled auditor. And third, highlighting a trend of growing institutional accountability, the CGHS has made HFR registration a mandatory prerequisite for fresh impanelment. They've noted that non-compliant facilities face automatic de-impanelment by April 2026.
Ultimately, these registries aren't just administrative checkboxes. They are the true trust layer of ABDM interactions. As digital integration becomes the standard for Indian healthcare, the question is your facility fully prepared to participate in this secure network? In our next explainer, we'll explore how health information actually moves through the ABDM ecosystem, including consent managers, personal health records, and the operational responsibilities of health information providers. Thank you for watching, and subscribe to the Caladrius Health channel for the next installment in this series.